Hello, everybody, and thank you for the kind invitation to talk about ReLEx Smile. So, as you know, it's the latest generation of laser vision correction. It's flapless, painless, safety and efficacy is proven through many studies. We have some possible biomechanical advantages, which still has to be proven, less dry eye, and so on, etc. But the question is, what are the challenges? And when we started back in 2011 with this technology, we asked ourselves, or we wanted to answer these questions. For example, what about low corrections, so thin lenticules? It's still one of the most frequent complications in ReLEx smile surgery to remove the lenticule. What about enhancement options? Which treatment works best? And what about very steep or very flat cornea, so extreme K values? Does this work similar to other laser technologies? What about presbyopia and so on? I want to point out some studies we published recently. So in this study, we tried to improve the safety of this surgical part of this technology, so to remove the lenticule easier. In this study, we had two groups, one standard thickness group, so which is preset on the laser with 10 microns minimum thickness of the lenticule, and the other group was a thicker lenticule group, which was a minimum thickness of the lenticule of 20 microns. So we add some neutral tissue to improve the safety and to make the surgery easier. And we compared the clinical outcomes, refractive outcomes, spherical aberrations, high order aberrations, and so on. It turned out that the refractive outcomes were comparable, but we had a statistically significant better safety and efficacy index in the thicker lenticule group. We had less spherical aberrations in the thicker group and less coma in the normal group. So all in all, it was comparable, but it really makes sense if you start with this procedure to maybe add some tissue to improve the safety. What about enhancements? There are many options published, like subcap lenticle extraction, which is not used in clinical practice so far. Thin flap LASIK, Ben Reinson and his group published a lot of great work on this. We published surface ablation, which is easy and safe after SMILE, and also circular. We had a publication recently. It's painless. We have some quick recovery. So, although we published both techniques, we could not really compare these groups because we had different MRIs in different groups. So we had also hyperopic treatments in the circle group. So that's why we conducted a matched comparative study, circular versus surface ablation. And we show in this slide that we have some tendency for overcorrection in the circle group. But of course, which is not really surprising, we had a much faster visual recovery in the circle group, and of course it was painless. So it was way more comfortable for the patient to achieve the perfect refraction as retreatment. What about the extreme K values? So what about very steep or flat corneas? The idea is, since we have to deal with a fixed shape of the interface, and we use vacuum, that the cornea is kind of squeezed into this certain shape, and this might interfere with the cut of the lenticule. So that was the idea. So we had different groups of flat corneas, which was determined below 42 diopters, and steep corneas more than 47 diopters. And it turned out that the refractive outcomes were comparable. We had in the flat group more spherical aberration induced. This might be because the pre-op level was lower, so the amount of induction was the same. So all in all, there's non-inferior outcomes in the extreme corneas, so it's safe to treat also extreme corneas with ReLEx Smile. What about monovision? I go quickly through. We had included 49 patients, presbyopic patients, and the near dominant eye was, the mean target was minus 0.8 diopters, and we achieved in 84% a full spectacle independence. So that was the proof that ReLEx Smile also works with monovision. So the conclusion, we have less limits in Smile over time, but it's still an evolution with room for improvements. Like you see here in this video here, the new VisuMax 800 was released recently, compensating for cycle torsion as well. We are waiting for wavefront optimized profiles and many, many more things. So there's still room for improvements. We're looking forward for that. So thank you very much for your attention.